Children are much more likely than adults to get ear infections, especially under 2.5 or 3 years old. The reason has to do with their anatomy. There's a tube which connects your throat to your ears called the eustachian tubes, and these are much smaller and shorter in small children, which makes it much more likely for viruses and or bacteria to get into the middle ear cavity, and that's what causes the infections. Common symptoms of ear infections in children are typically ear pain. Smaller children may pull or tug at their ears. They may not feed as well as normal, may have some difficulty sleeping or irritability. You can also have fever, cough, congestion, nausea, or vomiting. Treatment for ear infections, typically what we do is what's called the wait and see approach, which involves mainly supportive care by the parents, giving Tylenol or Motrin for pain or fever, making sure kids stay well hydrated, pushing lots of fluids, and just trying to keep them comfortable. A lot of ear infections will resolve with these measures on their own within about 2 to 3 days. However, if the symptoms persist, that's when we typically like to see them, and we'll consider doing antibiotic therapy in addition. It's not uncommon for small children to get multiple ear infections. They typically peak at about 18 months of age. If kids get more than the number we expect, or if they're happening more frequently than expected, kids will sometimes be referred to an ear, nose, and throat specialist for further management. Other things parents can try at home to minimize infection is just simple hygiene measures, making sure kids are washing their hands when they come in from outside, trying not to put things in their mouth, and just overall keeping a clean environment.